Thank you very much, Mayor. The situation with the coronavirus epidemic in Philadelphia is similar to where we were 2 days ago. Here are the numbers. Since this time yesterday, we've identified 136 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 30,213 since the beginning of the epidemic. Now, in the past week that ended last Saturday, July 29th, we were averaging about 165 cases per day. It fluctuates a lot day to day, so averages are worth looking at. That's up from 141 cases per day the week before and 111 cases per day the week before that. Now, the new cases that we're reporting today are still predominantly younger people. 33% were under the age of 30 and 57% were under the age of 40. Still, that does mean that there are people above the age 60 that are in the vulnerable group. In our hospitals, just an update here, as of yesterday afternoon, we had 158 patients with COVID infection in hospitals in the city of Philadelphia and 290 in the region. That's a slight increase from the numbers that we had 1 week ago. Still, though, it's very low compared to the number of patients we had in the hospitals during the peak of the first epidemic wave back in April. Since this time yesterday, we've identified 11 new deaths from the coronavirus infection in Philadelphia residents, bringing us to a total of 1,691 since the beginning of the epidemic. Of those, 859 or 51% were in nursing homes. Now, that 11 deaths that we identified in one day was a result of our matching against death certificates, and those are deaths that have occurred sometime in the past. Let me just give you an update on where we are with nursing homes. In recent weeks, we've had very few cases in nursing homes in residents or staff citywide. Nonetheless, with the increasing cases in the community as a whole, we're very concerned about this epidemic wave getting into facilities. This is clearly the highest risk situation of any of the situations across the entire city. And so we are now working collaboratively with Penn Medicine, with Jefferson Hospital System, with Temple's Hospital System to support the nursing homes citywide. That support will include testing for residents as needed, and advice on infection control and procedures, and any other education, whatever support nursing homes need. Our goal is to have so that the virus doesn't get into nursing homes at all, but if it does get into nursing homes, we absolutely limit it so that it's not going to affect residents in that nursing home. Just an update on where we are with testing. We are gradually expanding the number of sites where testing is available across the city, and having sites expand their hours, increase accessibility. Go to our website, www.phila.gov/testing, for more information on all the sites that are available across the city. We have had problems with laboratories with a very long turnaround time reporting results, unacceptably long. We are seeing a small improvement in that turnaround time with one of the two big national laboratories. And at the same time, we're still working on trying to redirect testing to local laboratories where we hope to get faster turnaround times. Still, though, it is far too long at a number of sites. That's where we are with Philadelphia. In the region as a whole, we are seeing increasing case counts in the collar counties around Philadelphia, as well as Camden, New Jersey, across the river. And we're seeing increasing coronavirus case counts in the state of Pennsylvania as a whole. Interestingly, in the nation as a whole, in the US, the epidemic looks like it might be just starting to decline. Daily case counts in particular are now clearly falling in the states that were the earliest states in the second epidemic wave, specifically Arizona and Texas and Florida. Those are still very heavily affected. They're seeing many cases per day, but the downward trend is a good thing. I'm hopeful that downward trend will go north in the same way the increasing trend in the past came north and have affected us. And just an update on dining in restaurants. 2 days ago, I announced that we were going to extend the prohibition on indoor dining at restaurants until September 1st. Just want to clarify that. First of all, the restaurant managers were given a pretty short notice for that extension, just a few days, and that was probably not enough time, and so we apologize that we didn't give restaurant managers enough time for that. I want to clarify, though, for the next deadline, that what we're saying now is we're extending this prohibition until at least September 1st. We don't guarantee that restaurants will be allowed to have indoor dining as of September 1st, but we want to give people a better sense of the timeline this time around. So we will make a decision about whether restaurants can start indoor dining on September 1st by August 21st. So the restaurants will have at least 10 days to plan whether they will be opening or not opening on September 1st. Also, that restriction on indoor dining is one of the restrictions that are part of our modified restricted green phase. Those other restrictions likewise are going to be remain in effect on the same schedule, at least until September 1st. That includes our senior daycare centers. Those are centers where I know many seniors want to go there, and the centers want to open up and provide those services. But we're very worried about seniors who are vulnerable to this infection getting together in a location where the virus could easily spread. Back in the community as a whole, we are working with businesses to have them continue to encourage and at times enforce our safety standards. Citywide, we have it was set up a number of weeks ago a process where the Medical Reserve Corps volunteers were going to businesses door to door to pass out flyers with our safety standards, our safety checklist, and also posters that stores could put up to remind people, particularly about the requirement for wearing masks. They're continuing to do that. They're in Germantown this week. They're going to be West Philadelphia next week. And they're going to continue to hit commercial corridors across the city. Let's talk about where we are with mask use. First, just a reminder, I keep coming back to masks. You see that ad over my shoulder because it's so important. Everyone just remember, wear one when you're outside of the house. This is something really should be standard equipment when you get out of the house. We have a media campaign like that picture across my shoulder here that's up across the city. And we want to increase mask use with that. There's now, as of today, a graph on our website that shows what our trends are in mask use in Philadelphia. This comes from our observations of people as they exit retail stores or as they pass through interior SEPTA stations. It's a new data system, so we're learning exactly how to interpret the results. So interpret them with some caution, but it does appear to be that there's an increasing trend. You see that the first data point there in June is somewhere around 60%. The most recent data point is at 76%. So the two lessons for this is, first of all, most residents are doing the right thing, but not quite enough. We'd love to have that at least 80%. I would love to have it be at 90%. So we just need to get the people who are not quite doing this yet to be using masks. And we're going to continue to track that weekly, but it does appear to be that it's moving in the right direction. Finally, I just want to talk a little bit about people who are unusually vulnerable to this infection in the city right now. You know, there is clearly more virus circulating in Philadelphia right now than is safe. So we want to remind people over the age of 65 or people with chronic medical conditions that you are at greater risk for a serious infection. The way to avoid getting infected is to stay home and then have other members of your household who are out and about and might be exposed to the virus. They should wear a mask when they're out and about. And when they come back in, you do not want to be exposed to them. So have them wear a mask when they're around you, even inside the house, if they've been out and about, and you should wear a mask when you're around them. It may feel awkward to be wearing masks when you're around your household members and your relatives. But if you stay home, that's your only risk. If you can prevent that risk, you can avoid getting this, what potentially be a very serious infection. So that's the update for today. More information on everything is on our website, www.phila.gov/COVID. Thank you.
Dr. Farley or the mayor, anything you can tell us, given the Phillies announcement of COVID cases, how the city is working with them, any updates there?
Simply to say that we have been consulting with both teams about this, and that we feel like the cluster is contained and that the people at Philadelphia are not at risk, and they're going to handle it from here.
Okay. And Dr. Farley, a question on you mentioned delayed turnaround time for test results.
Yeah.
I'm wondering, how does that have an impact on like the number of cases you're reporting per day? So when you say 136 cases per day, that seems lower than like the average for the last week. Do you expect that to increase in the coming days kind of retroactively as those tests come in?
Yeah, so if you look at the graph on our website, that's the date in which the test was run in the laboratory. And that's later than when the test sample was collected. And so that's not, the numbers I'm going to give you are not that much different from what's on the website, but what's on the website is a little bit of a delay from what's actually happening in the community. So it's not going to change the numbers I'm reporting very much, but it does mean that we do not have as up-to-date a picture of the amount of spread in the community as we'd like to.
Okay. And lastly, you mentioned the date by which you'll make a decision on indoor dining.
Right.
Can you comment on what would the situation kind of have to look like with the virus in order to allow that by September 1st?
I would certainly want to see our case rates falling, and I would say falling substantially to where we feel comfortable that this is we have less viral activity in the city. And I think evidence from elsewhere where there is indoor dining that they're not seeing the sort of outbreaks that we're seeing right now.
Okay, thank you.
Thanks, Laura. We're going to go to Jacqueline Lee of 6 ABC now.
Hi guys. So as it relates to indoor dining, Dr. Farley, you said that the collar counties had a much higher rate of positivity, but Philadelphia has not had indoor dining yet. Do you think indoor dining could be a reason why there might be a huge spike in COVID cases in places like Delaware County?
I'm certainly concerned where there is indoor dining that's a risk, and I can't say whether it might be feeding the increases we're seeing around the county. I do think it was the right decision for us not to allow it here, and I do think if we had done that, I would suspect that our case rates would be higher than they are now.
Do you think that the state needs to shut down again now that the collar counties are seeing a huge increase?
That's something that there's a lot of different factors. I'm not going to recommend that now. We're in constant contact with the state. If things get much worse, that may be something that they should do.
Hi, how are you? I just wanted to have a couple questions. One for the mayor, if he's still around.
I mean, our view about daycare centers in general, or pre-K age group, is that in general, the younger the child, the less risk they are for getting a serious infection, and maybe less risk they are for getting any infection, and probably the less likely they are to spread the infection. So that younger group is going to be safer than an older group. And also, PHL pre-K as well, other child care centers have a relatively small number of children in one place. They're not like a school that has 500. You're going to have small classes of children. So that also lowers the risk. And then we have a number of safety procedures for people to follow that would limit the risk. I don't think in any setting, though, to be honest, the risk is going to be zero. I do think that the risk is low enough that it makes sense when we're also reviewing the long-term, lifelong impacts of the education if they get there.
Yeah, and Dr. Farley, just in reference to the recent announcement by the school district of Philadelphia and what they're having to do in terms of reverting back to now just all online classes, how much of a factor did your research play into that happening as well, and then changing course on that?
We, as you might have seen at the school board meeting, we said that they could open if they followed our guidance. This was a decision made by the school district based on the concerns about teachers. It wasn't us that said that they could not provide in-school education.
The second question may be both for the mayor and for Dr. Farley. In Philadelphia, according to medical experts, there are serious racial disparities where minorities don't have access to internet to make virtual medical appointments or lack of access to transportation to get tested. There's also a lack of information in Spanish, and because the economic situation is getting worse due to the pandemic, there are now more minority families with less resources. How would a second wave be wouldn't it be more severe for these communities?
And let me add that there definitely are disparities in infection and serious infection rates by race and also by ethnicity, and that is a deeper problem than you might think. It definitely is reflective of our history of racism in this country and a lot of structural factors behind that. However, we do have a concrete plan to try to mitigate that as much as possible. Our racial equity plan is something we released earlier this week. And it talks about the steps we're taking to increase access to testing, to increase access to information, including information in community newspapers and information in Spanish. All of our materials are always translated into Spanish. Our contact tracing, we have one entire team that's Spanish speaking. So we're doing what we can. I do worry that if the second epidemic wave occurs, that it's going to likewise have a disproportionate impact on the people who are less enfranchised. But we're doing everything we can to try to minimize that.
All right. Hi, everyone. My questions are for Dr. Farley. So the first question that I want to ask you is about reopening schools. So we know what's happening or what's being proposed for public schools in Philadelphia. What are the differences between the charter schools and the Catholic schools versus, public?
Well, those other schools, the parochial schools, the charter schools, the private schools, they each have their own safety plans. We are reviewing those plans and we're having conversations with them to make them be as safe as possible. But so each one, they're somewhat different.
But are they different because they have a different amount of students in each, does it have to do with the student population? I mean, what's guiding this?
So let's be clear. So that we set guidance that said that schools could open in Philadelphia if they followed our guidance, and our guidance is published on the website. The school district, the public schools elected not to open, given concerns of teachers. These other school systems have elected to open, but either one could open, and as long as they're consistent with our guidance.
Okay. Now here's my final question. So the school district is saying that has said that some libraries and community centers would open so that parents can drop some kids off during school hours. What are you telling parents so far with that? Do you have any plan laid out as far as capacity, anything like that?
So, I could try to take a question, but I wonder whether Brian Abernathy wants to take that.
Dr. Farley, I believe Brian Abernathy also had to hop off for another meeting, so he's no longer with us.
I would just say that we are not encouraging right now parents to just drop their children off at a library or a rec center. We're concerned about many children being dropped off, and if they're not adequate safety procedures in any location like that. The city is looking to see if there are places and standards that could be put in place where children could go safely. That's not in place yet. And so we are definitely not encouraging parents to just have that be their plans. They're just going to drop off at the library and go somewhere.
Okay, just a quick follow-up. Do you happen to know at least when you'll have an update on that?
I'm afraid I don't, because we are part of that planning, but the health department is not leading that planning.
Hey, Dr. Farley, thank you for being available always. This question is really something that's bubbling up, what I would consider misinformation in the African-American community. Recently, we had this person who claims to be a doctor talk about hydroxychloroquine. And because of that conversation, the last 3 or 4 days online, there's been a lot of conversation around a famous African-American pastor in New York who was treated with that, but not alone. He was also treated with a antibiotic as a chromathin. Yes. Could you explain for my readers why hydroxychloroquine by itself is not a good idea and why the FDA said don't use it?
Well, hydroxychloroquine is a drug that's used to treat malaria, and there was some, based on laboratory information, there's some hope that it might have been effective against this virus. And there have been enough studies now for us to know that it's not effective against this virus. And any medicine that has any kind of effectiveness also has its risks. And so you never want to take any medicine that doesn't have any value. You would just be taking those risks. Specifically with hydroxychloroquine, there's concern about heart rhythm problems, where your heart flutters and doesn't have its normal rhythm, and that can be quite dangerous. And even if it's rare, it's not a risk that you want to take if the drug has no value.
Thank you. And then also going back, again, unfortunately, to some of our revisited conversations in the past, what is the challenges of being in an enclosed environment, like say, for instance, a church or a small area with a group of people who are breathing, singing, opening their mouths? What's the problem with that enclosed environment and not wearing masks?
Yeah, we're particularly concerned about religious services. People tend to be very close together. And when people are singing or speaking loudly, they're putting out more respiratory droplets, and they can easily travel to people that are close to you. If you're spending a long time there, and some of these church services can be quite long, then that increases the risk as well. Put that combination together, you can have some very major outbreaks in churches. And there have been examples of that, where many, many people were infected by a single person at a single church service. So that's a particularly high-risk situation, which we are recommending people be careful about. Our current restrictions are no indoor gatherings more than 25 people, but even with 25 people, they should really follow these other safety precautions about masks, distance, et cetera.
And lastly, for parents who are concerned about their kids, playing with other children who may be carriers of COVID, what suggestions do you have for parents? Should all children have a mask when they play with other kids? Should they be washing their hands? Should they be social distancing at the playground?
As much as possible, I do think if your children are around other children, they should be wearing masks. We know it's tough to get kids to wear masks. They're not going to necessarily follow you. But as much as possible, and you should, yes, have them wash their hands as much as possible. You can get secretions on your hands, and kids are always putting their hands in their mouths. I feel for parents who want to have their children be around other children. But right now, I would say if it's not really necessary, then try to avoid it. So, pre-K that's education. That's important in the long term. But other gatherings that are optional, I would say best to avoid.
Dr. Farley, this is a question for you. The Phillies came out today. None of the players have had their tested positive, but two members of the organization got it, and also they're canceling all activities at Citizens Bank Park till further notice. So my question to you is, do you believe that the Phillies should move their home games to another location?
I have not seen the news as of today. This is the first I'm hearing about that. I don't think so at the moment. I think that there still are ways that they can do this safely. They need to follow safety standards. For whatever positive test they have there, we can't guarantee that they got it at the stadium. And likewise, I don't think that the one baseball team of a relatively small number of people poses a risk to the city that it's around. We're a city of 1.5 million people. So the bigger question really is, can the league continue to operate safely? I think they can if they follow their safety protocols. I'm concerned that the Marlins may not have. I don't know about the situation, but I think if they can do that, they can do this safely.
My follow-up question for you is, we're less than a month away until college football season is supposed to start up. Do you believe that we'll be able to see college football start up in the fall for the city of Philadelphia and for the state of Pennsylvania?
I'm sorry, I didn't hear the question. Could you repeat it?
We're less than a month away until the start of the college football season, and do you believe that we'll be able to see college football games be played in for Philadelphia and for the state of Pennsylvania for this season?
Certainly in Philadelphia, we are not recommending this anytime soon. Right now, our guidance is that we strongly recommend against any competitive sports like football. Close contact, lots of opportunity for secretions from one person to go to another person. We never know what's going to happen over the course of several months, but right now we think that's a very bad idea.
And also, you're still working on with the Philadelphia Eagles about their season as well?
That is correct.
Hi there. Thanks for your time today. Wondering about shore points. It was mentioned before that there was concern about people going down the shore. I'm wondering what's your advice for people who want to go down the shore, and have contact tracers in the city, have they traced any particular outbreaks or anything to shore communities?
So the contact tracers have not identified specific outbreaks at shore communities. However, when we ask where you think you were exposed and what you've done during the time period when you might have exposed, travel to the beach comes up pretty frequently, and so that makes us concerned. So our recommendations based on that is for people to avoid the shore. It's not so much being in the ocean that is the risk, but when you go there, people are likely to stay at a beach house. They may be going in gatherings, they may be traveling together in a car. That whole process puts people in exposure with other folks. So I know this is tough, but we would recommend against going to the shore now.
So I was trying to unmute myself. Am I unmuted? Sorry, we're in the van, so it's a little complicated. So you're not finding cases directly down the shore. Are you able to share where many of these cases are going? And when you look at neighboring counties, Delaware County is one. Others are rising as well. According to their some data, past Delaware's a concern when it's compared to its population. Do you know what Philly is doing right compared to some of its neighboring counties?
Well, first, as far as the data, the data I presented 2 days ago was that amongst people who had this infection, 27% had traveled during the time period when they might have infected. And that's a lot. And the most common site they were talking about traveling to was the beach. So we don't know that they were infected at the beach, but the fact that it's that high makes us concerned about that. And that's our recommendations based upon that. I also noted that where we're seeing increases in New Jersey right now in cases is Camden and Atlantic County. So right down there on the beach. But as far as the other counties, there are many differences that will determine what the rate of rise is going to be in one county versus another. So I can't say that the difference between the rise in Philadelphia versus Delaware County is attributable to our more restrictive policies. I can say in general, more restrictive policies are justified, and I'm hopeful that we're limiting the rate of rise through that.
Hi, this question is for Dr. Farley. We mentioned the Archdiocese. It was briefly mentioned in a question earlier. Could you just elaborate more on that? I mean, have you reviewed the plan? Is that still happening? They plan to have in-person classes.
Right, so we have received their plan. We're in the process of reviewing that plan, and we will be talking to them about it.
Okay, great. And another thing, the school district, public schools, they've mentioned specific data points that they'll be looking at. Well, they didn't specify, but there will be data they're looking at after they go back to hybrid, and then they have some in-person in November after Thanksgiving. Certain changes in the data would trigger going back to all online. I know there's a meeting at 4 that might come up, but can you just address like what would have to change once schools are open? What would have to change for them to go back to all online? Would it be like a rise in cases, more spread person to person? How would you define that?
Yeah, so what we said before, when there was a discussion about actually opening in August or in early September, was that we couldn't lay out specific numbers, but we could say that the factors we're going to be looking at is the rise in rates or the change in rates across the community. We look at potential outbreaks in schools if schools are open. And then we're going to look at the connections between them if we have evidence that cases in schools are linked to cases in the community. The worse that any of those three factors is, the more likely we are to say that the school system really cannot stay open. If all of them are looking good, then we're more likely to say that they can stay open.